Coming up on Just Us Gals, Dr. Mithani shares tips to prevent the dreaded back-to-school germ spread. We dive into antibiotics, fevers, and the measles outbreak. I share my huge mom fail, and we play a round of Medical Mythbusters.
I'm Heather.
I'm Jess, and this is Just Us Gals.
Mommy.
Welcome to another episode of Just Us Gals, and today we have an ER doctor in the house, Dr. Shazma Mithani. Shazma, welcome. You are officially one of the gals today. How are you doing?
So great. Thanks for having me today.
We're so happy to have you. We want to actually pick your brain about back to school, all the germs, vaccines, just basically staying healthy as a family and with kids. But we do, as you know, like to start every episode off with a parenting win or loss. How are you doing this week as a mom? Do you have a win or a loss?
A win only because so it's Tuesday on the day that we're recording, and so I just had a weekend off of work, which means that I got to spend the whole weekend with my family and friends,
that's nice.
And so that was really great. And then the win was that my daughter and I went on like a 10K bike ride with one of her friends and my friend who's her friend's mom. And the four of us had a great time. It was just like such a lovely afternoon. We're finally having some nice weather here.
Yeah.
I'm in Edmonton, so some nice weather here. So it was good to take advantage of that.
Oh, I love that. That's there's nothing better than just like an Edmonton summer day where you have nothing else on the docket, nothing on the agenda. You can just enjoy it.
It was pretty great.
And I can imagine those days are very few and far between for you.
Yeah, I mean, so as a shift worker, I work about half of the weekends in a month. So it was really nice, especially in the summer. It was nice to have a weekend to just and we didn't even have that much scheduled, which was really nice too. We just had a couple things and just hung out with friends and enjoyed time outside. Did some gardening, which we don't always have time to do because it's always go with different things. So it was good.
You know, you get to the point where you like look at your garden, you're like, whoa, where did all these weeds come from? I know. It's like, holy cow.
Every year I say I'm going to garden till the end of the summer, and every year August hits and I'm like, well, there's a bunch of my dried up flowers. One year I'll do it. I swear every year I start, I'm like, I can do it. This is the summer. My kids are older. I've got it this time. No, doesn't happen.
Yeah. Shazma, how old are your kids?
My oldest is 9 and my youngest is 6.
Okay. And so our oldest are both 6. And then my youngest is 3, almost 4 in October. And then Heather's 2.5.
2.5.
Okay.
Yeah.
So you guys are still kind of in it for
for
the younger age, for sure.
Yeah, it's trying.
I actually just posted on our story today. I was like, and I posted an SOS because Parker, like she's 4 in October, but geez, when she gets mad, she sees red, and I need more coping mechanisms. Anyways, back to topic. Heather,
Is that your loss?
That actually is not my loss. I have a huge loss this week, but I'm gonna let you go first.
Okay, I had a loss, but now I can't remember what it was. But this one, what was it? Maybe
that
a
mom
few
brain.
days ago. I know.
We don't hang on to information that much.
No, I don't know why I don't write things down more. Because I'll be like, oh, I'll remember that, and then the next day I'm like, or no, I should say the next hour. I already have forgotten what I was.
For
trying
me,
to
it's like the next minute. To be honest, yeah,
it's so frustrating. I hope one day my brain will come back, but I definitely had my first more physical fight with the girls this past weekend, and they've never had it before. It wasn't a huge deal. It was just Chloe shoved Penny, and then Penny kicked Chloe. I don't know how hard. I didn't witness it or anything.
I definitely thought you were in there, like a brawl. I was like, what is going on over there?
Oh, you thought I was fighting this? Like, all right, put him up. You got to strengthen him up.
Well, I was like, where's she going with this?
No. It was I did say my first fight, but I just meant they haven't fought physically before. They've always been very good. So so I didn't even know what to do. I was just like, go sit on the stairs. And then I just made them think about what they did. I didn't know what to do. They've always been so good. I've been so lucky. So
how do you handle situations like that, Shazma?
Yeah, so if it's my kids have had many physical
brawls
at this point. So like just physically separating them, giving them space to calm down. If my husband's home too or there as well, then it's nice for each of us to like divide and conquer and give each kid some individual attention. But also in the moment when you're like angry and kind of like, why are you guys even doing this? It's hard to, come down
rational.
and think logically and rationally about things.
Yeah.
But
Yeah, no.
It's tough. Well, and then I find I'm always ill prepared too, because I'm like, what's the best like strategy to handle this? So like this morning we had a bit of girls were freaking out and I sent them to the room, and anyways, it was a whole thing. That's not my loss either. I have a really, really, really bad loss.
Okay.
So I
What
feel
is
like
it?
my husband and we did Emmy dirty, my 6-year-old. March 2024, she went for a dentist appointment. Teeth were beautiful. Everything was perfect. Fast forward a year and a half, she now has to get 2 extracted because they are rotting out of her head.
Oh, that's what you meant by extractions.
Yes.
I thought she had big teeth coming in.
No. She needs to get 2 teeth pulled tomorrow. And I feel so sad for her because I guess we gave her a little bit too much control with the brushing within the last year. And I did see something on social media that said if they can't tie their own shoelaces, they can't brush their own teeth. And it's just, I should have put up a bigger fight because brushing teeth is always a fight in my house. And I guess I'm just too soft. And I was like, fine, you can do it. The occasional time I'd help her, but she is Miss Independent and she would. So anyways, now she complains she's on antibiotics 3 times a day. And she...
Oh, because they're infected?
Yeah, because one's infected and it was like pussing. And so last Friday we had an
shoot.
emergency dental appointment, brought her in. Oh my God, it was just like, my nervous system at the end of it was like shot because just like the news just kept getting worse and worse and worse. And she has cavities, she needs 2 teeth pulled, it was pussing, she has an infection, like it's on both sides. Her baby molars, luckily. But so anyways, I'm sharing this because do not let your kids be in control of their dental hygiene. Do not. I saw something on Instagram where it was a dentist and she said, this is what brushing our teeth looks like every night. The kid is pinned down on the bed screaming bloody murder and the mom is brushing her teeth. And I'm like, ooh, that's a little extreme. Nope, that's going to be us now.
Yeah.
So poor thing has to get them extracted tomorrow. One of the sides still, the one that wasn't infected still really hurts. So I think the antibiotics, correct me if I'm wrong, is just dealing with the infection. It's not actually dealing with the pain. So now she's on Advil twice a week, I wish, twice a day. It has been since Thursday. And it's just like
Does
I'm
it
a
hurt
little
when
bit
she
of a hippie.
eats?
I'm not loving all the meds in her system. It's just like, no, it doesn't really hurt when she eats, but like,
That's good, I guess.
oh, big loss. What did I tell you?
that's a
ladies?
lot.
That's a big
Yeah.
loss.
Oh.
Yeah.
And also just, I mean, like the it's this and then it's this and then it's this. It's just like that would be very overwhelming as a parent for sure.
And then
It's a
yesterday
lot.
morning, it's nothing against my dental clinic, but it's not a pediatric dental clinic. So I was making rapid calls in the morning, just trying to get her into a pediatric dentist. And bless Gateway Dental, Pediatric Dental in Sherwood Park. They got her in and they like understood the urgency of the matter because a lot of other clinics were like, well, we need to see her first and then we can assess. This clinic was like, Kate, send us over her stuff. We'll get her in. She's booked into a procedure room. It's happening. So
My daughter, when she was maybe 5 or 6, she at the playground, I got a call from out of school care and I'm like, what? Why are they calling me? Like something has happened. She wasn't paying attention and she ran into one of like the metal bars at the playground and like smoked her face.
oh my gosh.
And they called me and they're like, one of her teeth is cracked. And she had 2 permanent teeth at the time. And I'm just like, is it a permanent one or is it a baby one? Like that was all that was going through my head. Anyway, so she cracked it. She had to just get some like sealant on it.
Was it the permanent
wasn't
one?
too bad. No, it was one of her baby molars.
Good.
But they gave her some laughing gas and she did great. So that more just to reassure you, Jess, like it's especially with the pediatric dentist, they know kids so well and
Yes.
they'll take really good care of her.
Thank you for that reassurance, which is exactly why I want to get her into a doctor or a dentist that specializes in kids. So
Yeah. Penny had 2 cavities this year and laughing gas to do it. And it wasn't bad for her at all. But again, on the whole, she now flosses.
yes,
And-
we're flossing now too.
Yeah. And then she did reveal to me, she's like, I actually don't brush my teeth in the morning. I was like, what? Again,
We also did a hard implementation of that rule too.
Yeah.
I know. I was like, that is so
360 around
gross. Yeah, God. She's like, why do I need to brush it in the morning? I brush it at night. I'm like, your logic isn't terrible, but it is wrong.
But it's,
So-
yeah, not quite. My
No.
son has, he's kind of just at the age threshold for Invisalign. So he has Invisalign right now. And you have to be really diligent about brushing
Oh,
because
yeah.
then when you put this tray on that, if there's like anything left on the teeth, it just holds it there. Right. So we are like morning and night, because he used to brush after every meal as well. So like that
Yeah.
he kind of does when he's at school and out of school care. But morning and night, it is either my husband or I that are like diligently brushing
Yep.
every single tooth and flossing.
I just finished Invisalign treatment, and I will say it is thanks to Invisalign that I have like my taking care of my teeth is so much more important now, just because I was flossing all the time, and now I'm like, now I can't go, if I eat I have to floss right after, just because after getting in that habit, I find it terrible. I couldn't not do it anymore.
Totally.
And it's just, and when you realize like I really should have been flossing more before, you're kind of like, I can't go back.
So-
TMI.
Shazma, so I feel like there's an oversaturation of information on social media in terms of medical advice. Right now, I think one of the big things I'm seeing is the correlation between flossing and Alzheimer's. Have you heard of that one? And
I've heard of it. To be honest, I haven't looked into the data in detail, but there is a lot of good data in general to show that there's a very strong link between your oral health and your overall body health. Like the mouth is still a part of your body, and there's lots of different, like it's a way in which like bacteria and other things can enter your body, right? And so there are strong associations between overall health and dental health. Even there's a strong link with like better a lower risk of cardiovascular disease when you have good oral health. And so it doesn't surprise me that they are starting to see data to show that it reduces your risk of Alzheimer's disease. For me, it makes it pretty obvious that dental care should be covered because it is a part of overall health.
Totally.
But, yeah.
Completely.
So Heather, you actually, just on the topic of Emmy having to take antibiotics, you did have an antibiotic question.
Yeah, so I'm sure this is what every doctor loves to hear, but I was listening to a podcast. And they were talking about just like how often antibiotics is prescribed to kids in particular. Like, and that's my experience with Penny too. Like, I go in, and if there's any type of infection, it's just, even if before they do tests, they just like, okay, it's probably this, we're going to get you on the antibiotics. Me, I've always been like, great, awesome. I just want her to feel better. I want her to be healthy. But then I listened to this podcast, and it raised a few things, and I'm like, well, maybe I should be considering this. They mentioned, how much antibiotics can actually screw with, this is a hot topic and word, but the gut microbiome and all that jazz. And I was like, am I actually doing more damage just automatically giving her antibiotics instead of trying, I don't know what, but other kind of remedies first? So I was just curious what your thoughts are on all of that.
Yeah, I have a lot of thoughts on that. So
Amazing.
I think that, so kind of to answer the short version of your question, like we've known for a long time that being on antibiotics can disrupt the natural flora in your body. So there are like normal bacteria that live on your skin, in your gastrointestinal tract, like in your gut, in women, in the vagina and the vulva area. There's like normal good bacteria in your mouth, normal good bacteria that live there in your nose. And that balance of good bacteria is what kind of keeps our body in equilibrium and homeostasis. And it's kind of a synergistic relationship. Antibiotics are not specific to a bacteria that are, it's like they will help a bacteria that is causing an infection. So if there's like too much bad bacteria or a bacteria that you've acquired from the outside world that shouldn't be in your body, that is when you get an infection. And so when you're given antibiotics, the antibiotic that you're given is specific to that bacteria, but it will also affect the other bacteria that are normal and healthy in your body. And so, yes, we've known for a long time that antibiotics can have a negative impact on the good bacteria that are on and in your body. The second part of that I'll say is there's certainly been a trend that I've noticed just anecdotally where it feels like antibiotics are just dished out really readily. And certainly the doctors that I practice with do not have that approach. We are very good about like antibiotic stewardship. And what I mean by that is like being very diligent and restrictive in giving antibiotics only when they're needed, because the other negative consequences of antibiotics or overusing is increasing bacterial resistance to antibiotics, right? So that's where we start getting these things like superbugs that are only, treated by a very, specific type of antibiotic. And we start getting these multi-drug resistant bacteria. So that's another potential negative consequence. And so when we think about things like antibiotic stewardship, it's thinking about whether a person actually needs to have antibiotics for the specific condition that they have. When we think about infections like respiratory infections, like coughs and colds, sore throats, ear infections, most of these infections are actually viral. So they don't need antibiotics. Antibiotics are for bacteria, not for viruses. And unless you have some sort of a test or even a physical exam in many cases to confirm that it's a bacterial infection, antibiotics aren't needed. And I think a part of the kind of trending towards overuse of antibiotics is also probably patient and parent expectations and so this is like, a much bigger topic than just what we're talking about here. But over time, I think there's been an expectation and a belief that antibiotics are going to fix everything, which they won't, and they certainly don't work for viruses. So, the example for ear infections, like over 80% of ear infections are viral, and typically the approach is to watch and wait for 48 hours and just treat with pain and fever medications like ibuprofen or acetaminophen. And if there are continued symptoms, then that's when a doctor would think about, well, okay, this is likely bacterial, then we're going to give antibiotics. Sore throats are another thing, right? So you can't diagnose strep throat by just looking. You have to have a swab, and most sore throats are viral and do not need antibiotics. So what I always tell parents is if there's a doctor who is going to prescribe you antibiotics, ask why, ask what specific infection is being treated, and ask whether there's a test that needs to be done, like a throat swab, or whether watching and waiting for the ear infection, or doing a chest x-ray if we're thinking about pneumonia, because most of these things actually are viral infections.
What did Penny have, Heather?
With all the different ones?
The times she was diagnosed or given antibiotics.
UTI, which they just assumed based on what I had described that she needed antibiotics for that. And then there has been one when it was a sore throat, but they said scarlet fever was going around. So they just assumed it was scarlet fever and gave her antibiotics for that. She's been on it for tons of different bad respiratory ones. So she's probably been on it 4 or 5 times. So maybe more than that. It's been a lot, and it just because I've always just taken it for word, here's antibiotics, and I've always thought, it works, so I might as well do it. I didn't even start thinking about what are and you know what's interesting? You mentioned the times that I've gone on antibiotics. Every single time I go on it, I end up getting
like a yeast infection.
Infection. That's the word.
Yeah, and
and it must be because of that.
Yeah, and so that there's good evidence to show that antibiotic use can increase your risk of yeast infections because it alters that balance of what the good bacteria and organisms versus kind of allowing yeast to overgrow that and making an infection or giving an infection.
So when I have had to take antibiotics after that, what I have done to counteract, I'll take probiotics. Is that something that you would recommend to maybe use with children as well? If they have to go on antibiotics, is there a benefit to giving them the probiotics or
So I would say that there's no harm other than cost potentially.
Right.
And I can't tell you the number of studies that have been done looking at that. And some say yes, some say no. What we do know is that probiotics are likely beneficial for gastrointestinal illnesses. So a viral infection where that can also disrupt the balance of good and bad bacteria in your GI tract. And so probiotics have been shown to decrease the length of illness and increase recovery. And then again, there have been studies that have shown potential benefit for taking probiotics with and after antibiotics. But the data is so mixed. But if you look at it in a pragmatic way, medicine is very much risk versus harm. And so there is really no significant harm in taking probiotics and potential benefit. And so in those situations, I think it's very reasonable.
Interesting. And so when, because I have been giving Emmy a probiotic, I'm assuming you shouldn't take it at the same time as the antibiotic, maybe in between doses, or when is the best time?
It's a good question. I don't actually know when, probably not at the same time as the antibiotic, but I would have to look at because there's probably nuance in the data there, and I have to look at that.
How much does it grind your gears when people are like, I'll just ask ChatGPT?
I had a podcast interview a few weeks ago where this came up because it is such a hot topic.
Yeah.
I think that it is a double, AI and chatbots are a double-edged sword. Being Canadian, we know that there are millions of Canadians that don't have access to primary care, and so they have to look somewhere. And ChatGPT can certainly be helpful to warn, if it recognizes red flags in terms of when you should see a doctor. I would caution though for making diagnoses, only because we have to remember that these AI chatbots are getting their information from the plethora of information on the World Wide Web. There is some reliable information there, and there's unreliable information there as well. And so it's hard to be able to necessarily know the nuance of how to tease that out without a medical background.
So we'll just stick to using it to plan 6-year-old Taylor Swift birthday parties then, Heather.
Yeah.
Oh, absolutely. Yeah.
Perfect. That seems safe.
Okay, so let's talk about back to school. That is coming up before we know it. And with that comes all the germs. What do you do as a doctor in your household to keep your family safe during this time?
So we have a rule of hand washing as soon as you come in the door. Hand washing significantly reduces the risk of viral infections, because the way that most of these viruses are transmitted is by touching something or someone or a surface that has the virus on it from an infected person, and then touching your eyes, your nose, your ears, your mouth, and that's how that virus typically enters the body. And
Ears.
Ears too. Yep. And so that is why hand washing is so important in preventing the risk of infection. And so my kids have, we've been doing this for years. Every time we walk in the door, I'm like, Kate, time to wash your hands. And they roll their eyes at me every time. But you know what? It's effective, and they do it begrudgingly. And then also,
it never gets easier.
Hey? It never gets, it does a little bit. Now my daughter's 9. And so she kind of also hates being sick, because then she has FOMO, because then she doesn't get to go to school.
Yeah.
So that is a good driver for her. Whereas my son is still he's the one that still brings all the infections into the house, because he's always touching his mouth and his face. I'm like, oh my God, just wash your hands. So that's one, good hand hygiene, keeping kids home when they're sick. So if my kids are sick, we have the privilege in our family of having some flexibility with scheduling, and parents who are in town as well, where we keep them home to prevent the spread of infection in the spaces that they go to. And then fall vaccines, right? Making sure that all the regular immunizations are up to date, and then getting your influenza vaccine for your entire family, looking at the recommendations for the COVID vaccine, in terms of whether that's a good choice for you as well. So just making sure that you're getting vaccines for known preventable illnesses.
You just had a post that went viral about vaccines. Tell us a little bit more about that. Everybody, honest to God, everybody I follow on social media was sharing that. So
I had a lot of friends
there.
I had a lot of friends telling me that. They're like, oh yeah, I didn't even know this person followed you, and they shared this information.
Yeah.
So there has been, in the province that we live in Alberta, there has been a change in how the fall vaccination access is rolling out this year. And so previously, you would have been able to go to any pharmacy or any public health clinic to get the flu vaccine or the COVID vaccine, depending
just
on
whenever
the age.
you want, right?
Whenever you wanted. Sometimes you need an appointment, but otherwise, it was pretty accessible. For us as healthcare workers, there was always a roving cart going around the hospital, and so I would always try to get it on the first day that it was available.
Yeah.
I would just get the vaccine. And so now what's happening is that there is a pre-ordering system that the provincial government has put in place, where you have to go and pre-order your vaccine for both flu and COVID. And I understand part of it in that they want to have accurate numbers in terms of how much vaccine to order and get rid of vaccine waste. My concern with that, and certainly why I put that information out there on social media, is that it's not been a very widely, it's not a widely known change. And so that means that people may not be getting access to the vaccine that need it. And when we think about public health as a kind of a general concept, where we're thinking about public and preventative health, vaccines pay for themselves exponentially in terms of being able to prevent hospitalizations and prevent deaths. And so my concern is that increasing barriers to vaccine access will have negative consequences when it comes to respiratory virus season in the fall. We'll see, more people coming into hospital, more people needing hospitalization, and poor outcomes because it is a barrier to getting the vaccine.
Interesting. That all makes a ton of sense. And there's also the measles vaccine, and measles is it still really prominent? Is it really going around still?
Yeah, so the latest numbers show that Alberta is like the combined cases that we've had in 2025 now exceeds the entire United States, which is really sad and scary. And we are still seeing measles numbers. And a lot of that is because of a decreased uptake in the MMR vaccine because of all the ongoing vaccine misinformation and disinformation that's floating around out there. So it's sad to see because there are, I mean, yes, measles is quote unquote just a virus, but we also know that there are significant negative consequences from measles in people who are unvaccinated. The risk of hospitalization is 1 in 5. There's risks of brain swelling, lung swelling, and pneumonia, long-term immune complications as well. And so it is sad to see.
So with measles, is it the people who are getting sick with it are people who are unvaccinated, or can you still get like maybe a lower version of it if you have the vaccination?
So yes to both. So the 2 doses of the MMR vaccine are 97+% effective at preventing getting measles. The 3-ish% of people who are still unlucky enough to get measles when they're vaccinated have a much less severe form of the disease. So we are almost exclusively seeing hospitalizations and complications of measles in people who are not vaccinated.
So I looked at my vaccination records in the spring when all this was coming out, and I've been vaccinated 3 times. But my last one was in 2007. Do you think I'm due for another one?
This is a good question. So 2 doses of the MMR vaccine are considered fully vaccinated and effective. There are some situations where a 3rd dose is necessary. I had a 3rd dose as well. In healthcare workers where they would check your levels, and if they see that you're low, then that would be a reason to get a 3rd MMR vaccine. In healthcare workers in particular, just because we're higher risk from exposure. And then also depending on when you were born. So I'm a child of the 80s, and at that time it was like borderline when we were still getting 1 versus 2, and so making sure that you have at least 2 doses or 2 doses is what's considered effective, and you don't need. Typically, it's like very unlikely. Only in very unique situations you would need additional doses beyond that.
So I should be good.
You should be good.
With my 3 doses.
How young is it that they do the first dosing of it?
So the routine vaccination schedule in all of Canada, the first dose is at 12 months of age, and then the second dose is anywhere between 18 months to 4 years, depending on what province you're in. So in Alberta, it's at 12 months and 18 months, so that's the 2 full doses.
Good then, Heather.
But in outbreak situations, there is often public health advice to consider getting an early dose at the age of 6 months of age. And then you would still need to get 2 more doses after that. So it would be a total of 3, but just to offer that early protection at 6 months, because we know that babies in particular, like extremes of age, we say, right? So young babies and older kind of elderly adults are most at risk from complications. And so that is something that you should, that you can talk to public health about if you have a young baby kind of between that age of 6 and 12 months.
Yeah. I know that if I had a under 12-month-old right now, I'd probably be a little worried. Just, it's a scary word. And, measles is something that I thought I wouldn't have to worry about. And now
it was eradicated in Alberta in 98, wasn't it?
It was eradicated in all of Canada in 1998. So we have like official eradication status.
Awesome.
And now Alberta is very much at risk of losing that status, which is also, it feels really wild that we have all of this great, all of these great resources from a public health standpoint, and like how many lives modern medicine has saved, and feels kind of odd to be moving backwards.
Yeah. So do you think social media is a big culprit of that? Like, I know it's hard not to be sucked into some of the things. I know at one point I was obsessed about the girls getting too much lead, and then like parasites, and I feel like there's just so much circulating on social media that, I don't know, do you think it's part of that culture shift?
Absolutely. I think that there's so much information on social media, it's hard to know as someone who is not well versed in science and health what to believe and what not to believe. And when we think about misinformation and disinformation in the health space, and so just for clarity, so misinformation is false information that is unknowingly spread. So for example, your friend sends you an article, your mom gives you an article that they believe to be true, and they're just passing it on to you, and you're seeing this information from a trusted individual, but it's not true. Versus disinformation is the deliberate spread of false information, typically for secondary gain. And so in the social media space, we see a lot of health mis and disinformation. And it's really challenging. It's confusing for people to see all of this information and know what is true and what to believe. And then the problem is that when we think about disinformation, and when I talked about secondary gain, a lot of times it's like health gurus, health influencers, wellness influencers who are often selling some sort of product as like, a catch-all, or this helped me, or go to the link in my bio to buy this supplement. And so they have secondary gain from that, and they are well trained and well versed in using words that sound sciencey, saying things that like certainly sound believable. And when you're someone who's consuming this information and you see that, and you're not feeling well yourself, and perhaps feeling dismissed by the medical system as well, because I do think the medical system has a role in pushing people away from medicine too. I very much understand why people are turning to alternatives to get care. The problem is that when you take a step back and think about it critically, this person's trying to sell you something. It's not based in science or evidence. And it's really exploiting the vulnerability of people's health and trying to make money off of it. And so it's really challenging to kind of navigate this new world of health at your fingertips as someone who is, a healthcare worker that sees the negative impacts of this and trying to just like be a voice cutting through all of that noise.
Must be frustrating as hell for you.
Yeah. Well, I've noticed.
It is, for sure.
Even like I'll see people who post stuff on TikTok or, social media, like parenting groups, and they'll just be like, how my kid has had this, and this issues, like any suggestions. And the amount of people, and I've seen that will often, the one I see a lot is heavy metal detox. But then on the flip side, I see people saying, that's insane. Like your body naturally does that. Why would you need to do that? And so I'm just kind of curious, like, what are your thoughts on those crazes and stuff that are out there?
Yeah, I think craze is the right word to use there, because these are all unproven, I'm not even going to say remedy, because they're not effective. So these are unproven things that are typically making people money because they're selling these detoxes and selling these supplements. Your kidneys and your liver do an excellent job of detoxing your body every second of every day. And you don't need to buy cleanses or buy detoxes to get rid of things that your body's already doing naturally.
Yeah, fair enough.
I kind of wanted you back to cold and flu season. I have a bit of a remedy that I swear by, but I want you to let me know how effective you think it might be.
All right. Let's hear it.
I swear by bee propolis. Whenever I feel a sore throat coming on, bee propolis. We do oil of oregano. I'll often take like a garlic pill, and maybe I'll give the kids like a spray of zinc. And then I put in some sage, like essential oil, like cold. It's the cold one, into the humidifier at night. And then I'll rub some like, not Vicks, but like, I actually use the brand Burt's Bees, like chest rub and under here. So thoughts?
So we do know that zinc actually has some good evidence for reduction of cold symptoms.
Okay.
Yeah, so it
Check.
will reduce the length of your symptoms. And again, for me, like when it comes to these kind of complementary, I'll say like complementary remedies, and if there is no harm, I don't get too fussed about it, right?
Okay.
But there are things that can, other than harm on your wallet, because these things cost money. But it's also important to know that there are some, supplements, detoxes, all of these other things that are often in this space as well that do have potential harm and are not well researched, and could have negative health effects. And so if you're talking about like having some garlic and some oil of oregano and some zinc, we know that humidifiers do reduce symptoms. Like there is good evidence for that. So if it's little things like that, if it's little things like that you think are helpful and effective, great. If that's going to prevent you from going to seek care when your kids are sicker, then I would say hard no. But if it's like just from a symptomatic standpoint, sure, go for it. Like these are things that are, for the most part, there is some evidence behind some of them, aren't going to have any significant harm. But when we start talking about like using these things in place of medications that we know are effective, or, the examples of measles that we were just talking about, there are lots of health and wellness and holistic influencers out there that are talking about using vitamin A instead of a measles vaccine. Like that's not going to help. And in fact, we also saw we've also seen cases of vitamin A toxicity in kids in the US as a result of that as well.
Oh,
and so there
wow.
are these things kind of as an alternative to conventional medicine. That's where I start getting worried and more frustrated and upset about it, because then there is potential harm if you're moving away from evidence-based medicine and using these as alternatives, versus if they're complementary and don't have any harm and make you feel a little bit better. I don't get too fussed about those things.
You did talk about something I saw recently about like fever information. And I just want to, like, with what Jess was just talking about when you were just saying, what are certain things that, you know, if your at-home remedies aren't working, what are those signs that you need to go and seek medical help?
For sure. So if we're talking about kids in particular, so if, first I'll say that in general, a fever is not bad or harmful. It's actually part of the body's mechanism of fighting off an infection. And, you know, a lot of parents will come in and bring their kids in worried that their child has a fever just simply by virtue that they have a fever. They're worried. That's not a dangerous thing. Situations where we start getting worried and want parents to seek medical attention would be if the fever is prolonged, so kind of more than 3 or 4 days. If there are, if it's a fever in someone who's immunocompromised, so a child under the age of 3 months old, a child on chemotherapy, or a known kind of immune deficiency or diagnosed immune deficiency, any fever, like any fever in those categories, you need to seek medical attention, because it's not that the fever is dangerous, but it could indicate a severe underlying infection and their immune systems are not strong enough to kind of fight off that infection on their own. And then if there's, signs of dehydration, so if it's a child that has vomiting or diarrhea or a gastrointestinal illness, if they're not drinking any fluids, if their wet diapers have gone down, if they are more sleepy, you can't wake them up, those are reasons to come into hospital from a dehydration standpoint. And the other thing that I often say is from a respiratory standpoint, so with like a cough or cold, if they're having any difficulty breathing, if there's any change in the color of the skin, again, more sleepy, or the catch-all that I always say to all parents is, if you're worried, come in. Every parent knows their child the best. And so if there's something that doesn't seem quite right or seems off, we as healthcare professionals take that in and of itself very seriously, because we know that parents know their kids the best, and it's not, the typical pattern of behavior of what they're used to seeing at home.
Oh, I love that you take that into consideration. As a parent, I appreciate that.
Me too.
Yeah, tell us a little bit about your podcast, though. It's a plethora of information.
Yeah, that was just a little snippet.
Yes.
Yeah, so the podcast is called the Doc Talk Podcast. I have an amazing co-host, Dr. Sheila, who is a family doctor in Toronto, also does a focus on women's health as well. And so between my being an emerge doc for adult and pediatric patients, her being a family doctor with expertise and certification in women's health and menopause, we really cover a big, broad spectrum of healthcare issues.
Yeah, it's a great podcast.
Yeah, we just finished season 1 last spring. Season 2 drops in September, and our first episode is actually going to be on back to school things for parents as well.
Perfect.
Amazing.
Yeah, and the idea is, the episodes are short. They're like between 20 and 30, at most 35 minutes, because we know parents are busy, and working people are busy, and we just want to use that time to get into the nitty-gritty of health issues in a way that is easy to consume and easy to understand for the general public.
Like info blast.
Exactly.
I absolutely love that, and I will 1,000% be listening to all your other episodes and tuning in September.
Please do.
That's so great.
Shazma, before we let you go, we kind of want to play a little game called Debunk the Myth. If you're
I like that. Yes,
okay.
absolutely.
So yeah, Medical Mythbusters. Does sugar make kids hyper?
I love that you started with that one. So I will say that the evidence shows no, it doesn't. However, in my own experience, it's hard to refute that. It certainly seems to change their behavior at nighttime in particular. Perhaps
Agreed.
it's just the excitement of having a sugary treat, but the data time and time again continues to say no.
I don't.
I'm not sure.
I'm believing that.
It is. Yeah, I have a hard time believing it just in my own family experience, but the evidence-based answer is no, it doesn't.
Okay. All right.
I know. Evidence-based, experience-based.
Real life experience, yeah. It's a balance of both, right?
Yes.
Yeah.
Motherhood experiences. This one's super random and kind of niche to me, not really family related. Though, actually, my daughters are kind of picking up on this. Does cracking your knuckles cause arthritis?
No, I love that myth. And no, it doesn't. So when you crack your knuckles, the sound that you hear is just the joint fluid, because there's fluid in every joint kind of just moving quickly from one side of the joint to the other.
Oh.
It does not have negative long-term health consequences. So no.
That's a bad habit of mine. And Emmy, I caught her the other day, I don't know, cracking her knuckles. I was like, no, don't do it.
Yeah, so no arthritis. I remember hearing as a child as well that it will make your joints bigger. Doesn't do that either.
Oh yeah, I remember that one too. And I was like, I'm gonna have skinny fingers forever.
Totally.
Never
I
crack
heard
my
that too. And
knuckles.
I'm like, is
Yeah.
that what my problem is? This actually, I remember hearing as a kid, if you chew your nails, you'll get worms in your tummy.
Oh yeah, I remember that one too.
Yeah.
Yeah, I would say that that's partially true. And the example that comes to mind is pinworms.
Oh.
So, yeah. I don't know. Creatures on the body, they just gross me out. But so pinworms are these tiny little worms that can infect the perianal area, typically in kids. And so the way that it's transmitted is that the pinworms lay eggs around the opening of the anus. And those, like if a kid is scratching their bum because it's itchy and then not washing their hands properly and then putting their hands in their mouth, or like transmission from like one kid to another, it's all by that route. And so like, yes, technically I would say that is that's something that could absolutely happen.
Luck of the draw on that one.
That's why hand washing is so important.
Back
Totally.
to hand washing.
And actually, I have a follow-up question on that after this. But okay, do onions in socks clear up a virus if you sleep with onions in your socks?
Yeah.
No,
Or
that's a
anywhere
very
in the room.
that's a very kind of common quote unquote old wives' tale that's been around forever. No, it'll probably just give you stinky feet. There's no evidence
And
to show.
bed sheets, let
And
me
bed
tell
sheets.
you.
Yeah, so there's no evidence behind that at all.
Well,
You're better
between-
off having a humidifier in your room.
I was gonna
instead.
say Jess is consuming garlic and sleeping with onions in her bed, so I'm gonna stay far away from her.
Or am I a vampire? Who really knows? Or no, warding off the vampires.
Yeah.
Actually, yeah, I slept with onions. I was desperate before my Vegas trip in January. My friend lives there. I was like, oh my God, I'm still too sick to go on this trip. And
Try
so
anything.
I tried everything. I slept with onions in my feet. I don't know if it worked. How do
I
we
mean,
ever
the
know?
virus probably just got. Went
It was
through
at
its
that turning
natural
point.
course, at the turning
Yeah.
point anyway. But I mean, I guess there's no harm, but it's certainly there's no evidence for it. And
Except for smell.
potential negative stinky side effects.
My
as
husband
well.
was not happy with me.
Yeah.
Okay, and then here we touched on fevers, but should all fevers be treated equally? I keep hearing that it doesn't matter what the number is, you just treat the fever for a fever.
Yes. So and not even that. So like yes, correct. It does not matter what the number is. In someone who is otherwise healthy over the age of 3 months old, who is not immunocompromised, a fever is not harmful, and you don't even necessarily need to treat the number. You treat the person. And so if your child is happy running around, maybe they have a little bit of decreased energy, they're still drinking well, and still sleeping and waking normally and still peeing a normal amount, you do not need to treat that fever.
Don't be
But
alarmed if it's a high
don't be
fever.
alarmed, and don't be alarmed if it's a high fever. You don't have to treat it. However, many kids will feel really crummy when they have fevers and are really sleepy and like low energy, don't want to really drink very much, and you can tell that they look uncomfortable. They're shivering. They look, yucky and gross. Please treat the fever. We don't want kids feeling unwell, because then that also would potentially increase the risk of like them not drinking enough water and becoming dehydrated. And so in situations like that, like absolutely treat the fever. So not the number so much as treat the person in front of you.
Still on the topic of fevers, teething causes fevers.
Myth, not true.
Myth.
Okay, noted.
That's
And
one I
then
heard all the time.
Yes, I remember
she's
that
just
as like my mom used to tell me that too, like when the kids were teething.
Old
maybe
wives'
they're
tale.
teething. Totally an
Yeah.
old wives' tale. Yeah, not
Yeah.
true.
Okay, and then lastly, a rectal thermometer is the best way to get body temperature.
Yes, so that is correct, especially in young babies kind of under the age of 1. It is the most accurate way to get a core temperature, and certainly the practice that we use in hospital as well. That's the route that we prefer in especially in younger babies.
I was confused on that because when my first was younger, I would call HealthLink for, I don't know, help. And she said, well, what kind of thermometer are you using? I said, I have an ear one. She said, don't love it because it can be a little finicky, but fast forward a couple years and HealthLink's like, what kind of thermometer are you using? I said, an ear one. She said, okay, great. I was like, well, what?
Yeah, so there has been a bit of a change in the technology of the ear ones. Like I would say in the last kind of 3 or 4 years in particular, but previously like tympanic temperatures were not particularly accurate. The worst ones are the infrared ones that you point at your forehead that don't actually touch you. Those are the least accurate ones.
Okay.
So the 3 kind of most accurate, rectal temperature would be the most, followed by under the mouth, but often kids, like young kids, cannot actually hold the thermometer there for long enough, followed by armpit, and then ear would kind of probably be in there as well.
When my second was 3 months old, she had a fever and I did a rectal and it was way higher than the ear reading. Is that normal?
Yes.
Wow.
Yeah. So the ear, like there is a discrepancy in terms of like the oral temperature is typically closest to rectal temperature in terms of the accuracy. But things like the ear can underestimate, the armpit can potentially overestimate. So there are some nuances there.
Okay. And then, lastly, I just want to ask, how do we try to instill healthy hygiene habits with our kids, hand washing, even when they're not at home, without instilling the fear of and creating germaphobes?
Yeah, and it's a fine balance. And we also know that like germs in the world are good. It's good for the our body's immune systems to be constantly being exposed to things and developing a memory to them. But like we also don't want to have like pathogenic things or things that are going to cause disease enter our bodies as well. And the most common route is again through the hands and the mouth. So for me, it's like hand washing. It's you just make it into a routine. So for us, like every time the kids come home, it's like a known thing, even with the eye rolls, that you wash your hands when you come in. And like being out and about, the other rule that we often have is like before putting food in our mouths, we wash our hands or use hand sanitizer, because that again is like a risky situation, or not risky, but like a high exposure risk, I should say, in terms of like, pathogens coming into the body. And then other than that, I have also myself had to like learn to just like let go a little bit too, because kids are kids, they'll be kids and they're going to get sick, and we can only do the best we can.
And illness is kind of good for the immune system every now and then.
Yeah.
Sure.
And like we can't fight off every virus and bacteria, right? And thankfully, we have like get vaccinated, have like all of your routine vaccinations to prevent the really bad things and the run of the mill things. Otherwise, sometimes you can prevent it, other times you can't. So you kind of just try to go with the flow as much as you can.
And get your information from a credible source. Dr. Mithani, thank you so much for your time. Where can people find you?
So they can find me on Instagram and TikTok with the handle at Dr. Shazma Mithani, and on the Doc Talk podcast as well.
Perfect. Wonderful. Well,
I love it.
Honestly, I learned so much today. Thank you. It's just reassuring to hear some factual information for once.
Really appreciate the conversation today. Thank you for having me.